Hi, guys, it's Dr. Sadaf, and I just wanted to give you an update as to what is going on. So, I have opened up my practice in Chappaqua, New York, and I'm currently accepting new patients. So, I want to invite you to come and become a patient of mine. If you've been listening to this podcast, you've been listening to the episodes, you are finding so much value in all of this. I want to invite you to become a patient of mine and come see the difference with a doctor that actually has time to listen to you and support you through the transitions that you may be experiencing, whether they're perimenopause, menopause, or you're experiencing any type of sexual dysfunction. And of course, I do annual GYN exams as well. So if you're not having any problems at all and you just need a regular exam done, I am more than happy to help you out. So make sure you check out the practice. It's called FemV Health, and the website for that is www.femvhealth.com. And make sure you look that up. The phone number for the practice is 914-538-2534. And make sure that you go and check it out. Check out the website and make sure you book your appointment today. Also, I have just started a new Facebook group. It's called It Might Be Menopause Support Group by Dr. Sadaf Lodi, FemV Health. And I'd love for you to come and join that Facebook group, because in that group, we'll be talking about different ways that you can get support and education as you go through this important transition in your life. It's also about building a community that is going through the same things that you are. Oftentimes we feel that when we go through things in our life that we are the only one, but I'm here to tell you that you are not alone, and that there are so many other women going through the same symptoms that you may be going through, whether it's hot flashes, night sweats, mood swings, vaginal dryness, pain with sex, brain fog, joint pain, dry eyes, any of those things, so come join us in that Facebook group. It's called It Might Be Menopause Support Group by Dr. Sadaf Lodi, and that's on Facebook. So come and join us in that community, and I definitely look forward to welcoming you there. And make sure that if you have any questions about any of the podcasts that I do, that you either DM me or email me, and I will create a podcast just for you, because you are a loyal listener and subscriber, and I would love to answer any and all of your questions. So if you have any burning questions that you are wondering about, please make sure that you email me at hello@femvhealth.com and let me know about your questions, or DM me on Instagram or TikTok, and I'll create an episode just for you. And as always, make sure you like, share, and subscribe to this podcast. As you know, I am looking to get over 100,000 downloads by the end of this year, and I'd love for you to help me out in that endeavor. And so please share and like these podcasts, download them, and let all your family and friends know, because I know there is not much information out there, and some of the information out there is not actually factual. So you want to make sure that you are getting your medical information from a board certified OBGYN that knows and has studied all of this material, whether it's sexual medicine, perimenopause, or menopause. So looking forward to hearing from you. And now to the episode. I am an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf Lodi, and this episode is everything you need to know about the psychology of couples. But before I get into it, the first thing I want to make very clear is that I'm not giving any type of medical advice. So if you have any questions about your relationship or how to make it better, please speak with your friendly neighborhood therapist, couples therapist specifically. And if you have any questions about your religion, please speak with your friendly neighborhood religious leader. This is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So today I'm super excited to have on with me Dr. Ammara Khalid. And Dr. Khalid, for those people that may be watching or listening and may not know who you are, if you could please introduce yourself to our guests.
Absolutely. Thank you so much for having me on. Hello, everyone. My name is Dr. Ammara Khalid, and I'm originally from Pakistan and I grew up all over the world, from Italy to Saudi Arabia, Chicago, New York. I did my undergraduate degree at NYU in psychology and gender and sexuality. And I got my doctorate here in Illinois at the Illinois School of Professional Psychology. And I think because I traveled the world and was always figuring out systems, school systems, how to create friendships, how to be the new person, I really learned to celebrate similarities as much as I celebrate differences. And so that really drew me to the world of psychology. And I am a family systems therapist, and I see individuals, families, and couples. I'm psych pack, so I can see people in, I think, over 35 states now.
Wow. Amazing.
Yeah.
That's great. Fantastic. So, I know you talk about couples, and I don't think I've had anyone on actually that deals specifically with couples. So I'm so happy to have you on. So tell me a little bit about the work that you do with couples, and what is, let's say, one of the most common reasons that somebody would come out, a couple perhaps, would come out and see you.
So in the last 15 years, I have seen couples from all walks of life, people coming in when they're dating, people coming in for premarital counseling, wanting to make sure that, they're getting ready for their big day and want to avoid family drama, especially if you're South Asians, because multiple events for weddings. Parents of young children, parents of adult children. So I really see couples from all walks of life. Sometimes there is, you know, issues around communication. Other times it's intimacy. Other times it's more focused on attachment style. And when working with couples, I really like to integrate EFT, which is emotionally focused therapy, pioneered by Sue Johnson. And I'm also level 2 certified in Gottman level therapy. So I really find that different couples respond to each one a little bit differently. Some people like more structure. Some people are really curious about their attachment style and how that influences their relationship, the communication patterns. So I see all kinds of couples. Also specialize in same sex couples, um, intercultural, interracial marriages. I've also worked with polycules. And so I really see a full spectrum of relationships in my work.
Wow. So tell me a little bit about EFT. I've never heard of that before, but that's not surprising because it's not really the world that I live in, since I'm more of a physician. But tell me, what is EFT, and tell me about the Gottman. I follow the Gottmans. I think they're fantastic. And I know about like the 6-second kiss, right? That they
Mhm.
talk
Yes.
about to increase emotional intimacy. So I'd love to hear about both of those modalities.
Yeah. And they're both great because they're cross-culturally validated, they're empirically based. With EFT, Sue Johnson has done so much work around the world, really, in the marriage and family therapy community, looking at how we respond to each other's attachment cues. So we're looking at attunement, we're looking at how engaged we are with our partners, how responsive we are with our partners. And having that attachment background allows us to see what happens when one person may have a more anxious style and one person may have a more avoidant style, and how we get stuck in what Sue Johnson calls the demon dialogues, right? Because so many of my couples will come and say, it feels like we're having the same argument over and over again. It could be about money, it could be about chores, it could be about parenting, it could be about sex. Ultimately, it feels like they're having the same fight over and over because they play the same roles over and over. And so EFT looks at certain common trends or patterns that we see in relationships. It could be withdraw, withdraw. It could be pursue, withdraw. It could be attack, attack, right? Or it could be just completely shutting off from our partners. So understanding how we get there. And one of the beautiful things about EFT is that it takes into account the neurobiology of love, right? The physiology of love. and looking at how our heart starts to beat faster, or our hands get sweaty, or we may feel something in our gut, right? Because emotion is so fast. People go from 0 to 60. But if we can start to slow down and pay attention to the cues from our physiology, we can start to slowly, with practice, make sure that we're not falling into those same traps. So there's a lot of accountability with EFT too. You have to really look at your own style and recognize when you're getting triggered or when you're feeling shut down and how to manage those reactions. Whereas the Gottman approach is very similar. And, I've been in workshops where Sue Johnson, may she rest in peace, and the Gottmans have, talked about so much of their work having overlap. But everyone likes to feel like they're doing things differently. I mean, the Gottman ran their marriage lab for, I think, about over 30 years, where they would observe couples, also looking at neurofeedback. They would have heart monitors and all the physiological data to see how couples would fight. And I think they got it down to an art of, like, within the first 7 minutes, knowing
Oh,
whether a couple would stay together or not.
no
But
way.
one of the most important statistics that they've talked about is that 69% of all problems in relationships are unresolvable.
69.
69,
That's
yes.
crazy. Unresolvable. What does that even mean? That means like you just argue and fight all day? I mean, what does that mean?
I think what it really means is cultivating acceptance and not trying to change your partner. Because, and I always give the example of my maternal grandparents who were married for almost 65 years. And I would always ask them, and they had a happy marriage. They had a very happy marriage. And I was like, how do you do this for this long? And underneath all of their fights and disagreements was the sense of, well, this is my person, so I have to practice forgiveness. I have to
Hmm.
have compassion. And that's really what we're cultivating, not just for our partners, but even for ourselves. And I think when we lack self compassion, we don't have compassion for other people,
Hmm.
especially in romantic relationships. And we get so stuck and entrenched in the blame game and figuring out who the bad guy is. So when I meet with couples, I talk about neither of them really being my client, but the relationship is my client. And we have to figure out what's best for the relationship. Sometimes it's best for them to stay together, work things out. Other times it's not. And we're constantly looking at our goals, looking at where we can make progress, where are we getting stuck. And ultimately, my sessions are 50, 55 minutes a week, but it's the work that they do outside of the session that really makes a difference. And I try to reframe some of these arguments as opportunities. It's an opportunity to try something different, to practice one of the skills that we've talked about in our sessions together.
Right, right. Amazing. So, really, a lot of interesting things that you mentioned. I mean, wow. I mean, my mind is totally blown. About 69% of the things are just unresolvable. I would have thought that perhaps, I feel like a lot of our elders will say that, it's just compromise, right? That they just, will just compromise on whatever they, perhaps things that they wanted or perhaps things that they need. But, other times people say that no, compromise, it's not good to compromise. Because that means you're not really staying true to what it is that you really want. What do you think about that?
I think there's a lot of nuance there. And I think we have to really look at, again, what are the goals for couples therapy? Because everyone wants to be heard, everyone wants to be seen. But when we become blocked, we can't see how our words, our actions may be hurting the other person. And so I always say, couples therapy works if the two of you are aligned on some shared values, some shared goals. But if those values and goals are completely misaligned, then there's really nowhere for us to go.
Right. Right. It's really interesting. So tell me, when you talked about the Gottman Institute and, you being certified in that. So, and I know that you said they, within, is it 7 minutes, they will realize whether or not a couple will, how do they do that? Is that just with like a questionnaire? Or is that just by looking at body language? Is that by asking, specific questions? Like, how do they do that?
I think it's a culmination of all of it. I mean, I imagine that being in this marriage lab for over 30 years, they got really good
Yeah.
at picking up on the smallest of cues, the body language, tone, a certain look, um, even just a lift of the eyebrow, right? Like all of these subtle things. And I think even when I sit with couples, now my practice is completely virtual, but when I would be in the room with couples sitting across from them, there was so much that was happening that was beyond the content of what was being said, right? Because as a therapist, I'm not only focusing on the content, I'm looking at the process. Like, where is this cycle going and how do we get there? And even the smallest of gestures, if someone is crying and their spouse reaches over for a Kleenex and hands them a tissue, right? That's a bid for connection, even in that moment. And that's something the Gottmans are really known for. They talk about bids for connection, the four horsemen of the apocalypse, which I'm sure you've heard of.
No,
Um,
tell me.
okay.
What is that?
So bids for connection are, small ways in which we try to turn towards each other. So let's say you're sitting down reading the morning paper and your partner says, "Hey, look at this blue bird outside. It's so pretty." Now you have the option of either looking up and connecting and saying yes. But if you are so engrossed in whatever you're reading and not really engaged, that's a missed bid for connection. And so there are ways in which, we make these bids, small bids, larger bids, and they talk about, needing to find the right ratio
Ah,
to help sustain relationships.
so
And
interesting.
then
Mhm.
they also talk about the four horsemen of the apocalypse. So,
The four horsemen
yes.
of the apocalypse. Tell me more.
So, again, because they did all of these studies in these clinics, they realized that there were certain signs that indicate that this marriage was heading for disaster. Now, one example is, sort of a milder one, is criticism.
Okay.
So sometimes we will have complaints, right, with our partners, which is fine. It's important to express yourself. When complaints become criticism, then you start to feel shamed, right? You feel judged. And that can be a precursor to a lot of problems, not just with communication, but with closeness, with feeling connected, with feeling seen. So that's I think, one of the common ones that I often see in relationships is
Mm.
criticism. Then we have, the extreme end, which is stonewalling.
Oh, yeah.
So stonewalling is, I don't even care anymore. I am just so full of apathy that I'm disconnected. And I have a really hard time seeing that my partner is trying to engage. And stonewalling can be, you see a lot of this in like the silent treatment.
Yeah. Yeah.
So so those are some things that I look out for, because if it's, and another horseman is contempt.
Mm.
So if criticism is level 1, then contempt is level 2,
Ah.
because contempt can be really, really nasty.
Hmm.
Um, and it can really feel like an attack from your
Wow.
partner.
Yeah.
And, one example of contempt, even a nonverbal example, is when two people are talking and one person rolls their eyes,
Oh,
right?
man. Yeah. Mm.
Yeah.
So
So
interesting.
those are some of the signs to look out for.
I wonder, do you feel like you can like you get the same sense as when you were actually in person with the individuals? Because there's so much body language, right? Like I know that telehealth is definitely more convenient and it's so much easier for so many individuals, right, to access therapy that may not be able to because of work, distance, all of this stuff. But at the same time, there's something about that human touch, right? That face to face, that those subtle body language, things that you may not notice on telehealth. What do you think?
I think there's some truth to that. And, sometimes I'll have sessions where the couple isn't even in the same location, right? Because they're
Um,
across the
yeah,
country or they're traveling or they're in different, so everyone's on a screen.
yeah, that's
So I try to encourage my couples to have sessions in the same place.
right.
That way I can at least kind of observe some of those things. But if they're in different locations, it's much harder to
That's true. Yeah.
observe any cues. Yeah.
Right, and definitely, at least this way, they're keeping their sessions, and they're being at least a little bit consistent. I'm interested to know about like sexless marriages. Like, do you have, definitely this, so this is called the Muslim Sex Podcast, and I've done a lot of podcast episodes on relationship, like intimacy coaching, which is something that I do. I talked about creating vulnerability and the different types of intimacy that there are with experiential, emotional, physical, all those things. But I'm curious if you see a lot of sexless marriages. We know that sexless marriages are one of the top 10 reasons that people tend to get a divorce. I'm sure you probably see that a lot in your couples therapy.
Yeah, I do. And, I see people that have had sexless marriages that have worked to change that, and other folks where it really hasn't changed, but maybe their understanding of the relationship shifted. And so, with some of my clients, as a trauma informed therapist, I'm very mindful of people's history, people's relationship with their own bodies. I speak very openly about sex, masturbation, pleasure, sex drive, libido, all of these things, taking into account, physiological issues that may be present or psychosomatic issues that may be present. And I will say that there's a lot of hesitation with some of my South Asian clients because there's still so much shame and stigma when it comes to talking about this.
Yeah.
Um, and especially with some of my older Muslim clients, it's a bit jarring for them
Yeah.
to have me ask these questions. I've even had to sort of translate and ask questions in Urdu for
Wow.
some folks where English wasn't their first language and they were more comfortable speaking
Wow.
in Urdu and Hindi. And that was something that I had to work through as well. Like, how do
Wow.
I ask these questions in a
Yeah.
professional
I'm
way?
curious about that
Um,
too. I'm Pakistani and I'm like, wow, how do you ask those questions? So,
yeah, yeah. And I think, part of being a culturally competent therapist is really knowing how to match the pace of your client, right? So with certain clients, that may be part of my standard intake. These are very, you know, general questions that I ask everyone. But with clients from certain backgrounds, certain cultural norms, expectations, I may wait until there's more trust, more rapport, more comfort with me before asking some of those questions. And so some of my clients, I have been working with one couple for about 11, 12 years, I think.
wow.
And they're primarily in a sexless marriage. And um, they work really well together. There's a lot of love and affection there. They're really good at co parenting, but sex has been an issue since the first time they came in to see me. And there's layers of, trauma, body image issues, all kinds of things. And so we've explored that in multiple ways and found ways in which we can meet each other's needs, but also be sensitive to, you know, being trauma informed and being aware of what else can be coming into the bedroom with them, so to speak.
Wow. So is there hope in that particular relationship that you've been working with? for those 11 years of a sexless marriage. I mean, is it something that they're interested in fixing, or obviously because they're coming to you, but
They're still coming. Yeah.
yeah, yeah,
They're still coming. And I think that part of my work with them, I mean, it's shifted over the years, right? When they became parents, it was different versus, now they're parenting a toddler. There's different challenges, but finding the time for connection. And I think, connection can look like so many different things in a marriage. It doesn't always have to be about sex. It can be about other ways of feeling close to your partner. Um, and sex also doesn't mean penetration. It can mean other types of pleasure, other activities.
yeah.
One of the things that I really incorporate into my practice is sensate focus that was
Love
developed by
sensate
masters in.
focus.
You love sensate focus? Yeah,
I
I
use it
think
all the
it's
time.
great. And I think it can be adapted to just about any situation, whether you're
Yeah.
working with heterosexual couples, same sex couples, folks with a trauma history. I think there's lots of ways to move from one stage to the next. It doesn't have to be very linear. Sometimes we go backwards before we move forward. But that's a great way to, talk about some of these things and give people the tools that they need to find connection with each other.
Yeah, I love Sensei Focus. I talk about it all the time. In fact, I had Linda Weiner on, and she does webinars and things like that. And she came onto my podcast, and we talked about Sensei Focus. I love it. And also had Lori Brado on that talked about better sex through mindfulness, and just how the two modalities kind of overlap, really focusing in on the senses and the touch and all of that. And I think that especially, I think the sensate focus, I think, is fantastic for anyone that's experienced trauma and in a relationship, and or even like abuse, or even for those individuals that have never had sex before. And are just exploring, or somebody that's never been intimate with somebody else, even with themselves, right? And I
Yeah,
that
yeah.
that really allows for that exploration, and it just allows for exploration without any type of um, like just requirement for the at the end, right? There's no pressure for sex penetration. There's no pressure for orgasm. There's no uh,
Hmm.
pressure for performance. It's really for just the act of exploration and just learning and seeing how that skin
Yeah.
feels, under the touch, pressure, texture, all of that.
Yeah, all of it. And I remind folks, like, we don't exist in a vacuum, right? We receive messages about closeness, about intimacy, about sex from, family, for better or for worse, from Disney, from Hollywood, Bollywood,
Yeah,
from
yeah,
all the media. And, it's not what you see on TV that two
yeah,
people will have a mutual orgasm and everything is just wonderful, right? If you get there, great. And if you don't, that's not the only way to find
yeah,
happiness.
yeah, absolutely. I think that, so many people learn, especially those that perhaps have not had sexual experience before they got married. I think that sometimes the only, access to learning for them, if there's not any type of sex education. And we know that even here in the US, a lot of states, we know that sex education is based on
Yes.
the state that you're in, and also the zip code that you live in, right? Because I could be living in New York, and in lower New York, they may be more democratic and whatever. So their sex education is going to be different based on the Board of Education and the people in that on that board, as opposed to say somebody that's in Central Valley, New York, and their thoughts may be different and more conservative. We were just, in fact, I was upstate visiting my son at college, and just my husband turned on the TV, and there were like these commercials, and the commercials that were coming on were crazy compared to what I would, like think.
What kind of
Well, I
commercials?
mean, they were just like more conservative. They were like, talking about the upcoming election and the people running for
Mm,
election, and, oh, this person is going to, allow this to happen. And can you believe this? And blah,
right.
blah. And so, really just the banter that occurs between the two parties, right?
Yeah.
and what they're saying. But, like I know that those commercials would never fly like in lower New York. It just doesn't make
Right.
sense. People would not believe that nonsense.
Yeah.
But whereas in like Central Valley, New York, perhaps
Mhm.
people are more likely to believe that. I don't know. I don't know. But we
Yeah.
definitely know that sex education is definitely based on zip code. And we
Yes.
know that what the state of Florida actually just passed I think there was a law that you can't teach sex education in the schools. I mean, it's just crazy. That just happened last week.
Yeah.
So, I think for people that don't have access to sex education and then are getting married and, don't really know much, I think that Sensei Focus is a fantastic stepwise, process so that
Mhm.
there's no pressure on the individual.
Yes.
Um,
Yes.
and you just take it as it goes. So I think I just,
Yeah, and it prioritizes communication and consent, which are so
yes.
key.
Yeah.
And you always have partners checking in with each other.
100%, 100%. And I just think that that's so fantastic. And I think it's just such a great way to go, especially ease into like a relationship so that there's no pressure on the other person. Especially, I think, like sometimes for men, they feel that pressure to perform.
Mhm.
And, with that, and I think that leads to a lot of like premature ejaculation and erectile dysfunction. And
Right.
I think that when you take those things off the table, then and just let things happen, then I think that helps a lot in individual
Yeah.
relationships. And I think that also helps with vaginismus as well,
Mhm.
you know?
Yes,
And
absolutely.
there's a lot of unconsummated marriages, especially in, Southeast Asian relationships and marriages. And I think that if we use these modalities that focus more on just pressure, texture, touch without any type of end goal, that I think
Yes,
that really helps individuals.
absolutely.
So, what would you say in creating intimacy in a relationship? What are some key factors in creating that between a couple?
I think we need to be self aware, and within the self awareness realm, we're talking about our own attachment style. We're talking about learning how we receive pleasure, how
Mm,
we want to give pleasure, how do we receive affection, how we receive compliments, how do we receive all of these things,
yeah,
and how do we express them, how do we give them to our partner. Sometimes you'll find people are in alignment, but other times you may feel like, oh, I'm doing so much for my partner, here's my love language, I'm doing all these acts of service, but it's not so much about acts of service. They feel really close and connected through physical touch.
yeah.
So we can miss cues. And so we have to know what our own love language is, what
Mm,
is the love language that our partner needs, and how do we bridge those gaps. And I think talking about sex openly, right? Like there's no shame in it. There's no, um, I think people feel like it's sort of those topics that should just kind of evolve and we'll figure it out naturally without getting into the nitty gritty of, well, what do you like? And here's what I really enjoy. Or what if we try this? Um, Trying to create a sex positive relationship.
100%. Yeah. I think that that's really, I think that that's one of the things that I think is so important, right? Is changing the narrative. I think that a lot of
Mhm.
people, whether or not they know it, they may have grown up with in a very sex negative environment, community where, sex was wrong, shameful, dirty. And so, they've grown up with that. They've kind of taken that in. And so it's almost as if they don't give themselves permission to experience pleasure
Mhm.
because in the back of their mind, they're always thinking that it's wrong. And
Yeah.
I think that once they, are able to let those thoughts go, then
Mhm.
they're able to move forward. And I think that that's
Yeah.
really helpful.
Because sex doesn't only has to be one thing. Sex can be romantic, it
Yeah,
can be passionate, it can be
yeah,
playful, it can be so many different things. It can be
right.
tender, it can be all of those things. And
Sure.
good sex is a good mix of all of these elements.
Yeah, absolutely, absolutely. So what communication tips do you give your couples?
So sometimes if sex is something that they haven't really talked about, I'll encourage them to just self-reflect and maybe write down a few things that they know that they do enjoy,
Yeah.
whether it's receiving, whether it's giving, whether it's self-pleasure, whatever it may be, and to have a conversation about it, but not really get into let's enact this. Just creating some sense of comfort around naming things that they enjoy, being able to articulate it, and always checking in with each other, because if anything starts to feel uncomfortable, we'll come back to the therapeutic space, talk about it, and then move forward. So communicate in a way that's clear, communicate without expectation,
Hmm.
right? Like just because I put something out there doesn't mean now this is how it's going to be. It's like communication with anything else. There's some trial and error. Maybe we'll have some awkward moments in the bedroom. Can that be okay? Can we laugh about it?
Right.
And so really approaching it with a sense of compassion, curiosity, confidence too. Um, how you feel about your body. I talk to clients a lot about what makes them feel good. Some people want the lights on, some people want the lights off, some people want lingerie, some people want sex toys, some people want I work with folks in the kink community, so we talk about those elements. So there's really no one way, no right way to do this. It's about consent, it's about pleasure, it's about playfulness.
Absolutely, 100%. I think those are definitely key takeaways, right? I think consent is one of the biggest things and something that I talk about a lot as well. I think that consent is so important and communication, right? There's been studies that have shown that the number one factor in whether or not women were sexually satisfied in a relationship was communication. And that just makes sense, is
Absolutely.
that, right? You have to let the other person know and they have to know what you like, what you don't like, what your fantasies, what your desires are, all that stuff, so that you can move
Yeah.
forward in your relationship. So what would you say are some key pearls from your years of practice with individuals and with couples in defining, let's say, like a successful marriage? Not defining, but helping to promote a successful marriage. What are some key pearls? You had mentioned communication. Are there
Hmm.
other things that you would say are just absolutely key in creating and fostering a healthy, happy relationship?
I think one of the things that I talk about, especially as an IFS practitioner, internal family systems, is the idea of parts. We all have different parts to ourselves. Some parts may be critical, some parts may be fearful. And what I ultimately believe is all of us have the capacity to access our intuitive, wise self, the part of us that is, you know, compassionate and calm and confident and curious. And anytime we let some of these other parts take over, it's like chatter in our heads, right? And so being able to come back to your authentic self will allow you to show up authentically in your relationships. And so I'm always thinking of us in relations, not just in our relationships to others, but how are we in relationship to ourselves? What's your relationship like with your body? What's your relationship like with pleasure? Where do you allow it? Or is it forbidden? Or is it something that must be conditional and must be earned? So these are some questions that I think really open us up to thinking about how we show up in relationships.
Hmm. Yeah, that's fantastic. Now, I'd never heard of that concept before of thinking ourselves in parts. That's really interesting,
Hmm.
right? And I think that I agree with what you said about showing ourselves compassion. I think that that's one of the most important things, right? I think that when we're able to be kind to ourselves, then we're able to show that kindness to others and that compassion to others. And I think that when we are so, if we are obviously and all the time, if we are continuously judging ourselves and being very critical and harsh with ourselves, then that's almost a prelude to how we're going to be with others. So I think
Exactly.
that starting with love and compassion of yourself,
Yeah,
will only lead to love and compassion of others.
absolutely.
Yeah, absolutely. Well, this has been fantastic. I'm so glad you were able to come on. So, for those individuals that are listening to you and hearing you and watching you and thinking, like, wow, she is amazing. How can I get in touch with her? How can I work with her? How can people reach out to you? How can they work with you?
You can find my practice, which is riapsychologicalservices.com. They can read more about me there. They can also follow me on Instagram. My handle is at dr.Ammara Khalid, where I post videos and different posts on couples, on sensate focus, on all of the different things that we touched upon today.
Amazing. Well, thank you so much for coming on. This has been so amazing. And I love the fact that we're focusing on couples, which I don't really get a chance to do very often. I typically focus on the individuals. So it's always great to learn and listen about how we can improve relationships and the couple as a unit. So that's been great. So, well, I am done here, and it's been real and really intimate. And of course, it's not meant to be any type of medical or religious advice. So, if you are having any issues with your health or your religion, please speak with the appropriate provider. And until next time, this is the Muslim Sex Podcast. So, thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So, be sure that you share it with all your friends. And thanks for listening.